Good day, I'm Tamara McHale, and this is your JIS news for Thursday, June 30. The Labour and Social Security Ministry will be strengthening, expanding and diversifying the range of job opportunities provided under the Overseas Employment Programme this fiscal year. During her contribution to the sectoral debate in Parliament on Tuesday, Portfolio Minister Shahini Robinson said the ministry was aiming to place 16,000 Jamaican workers in the North American market by the end of the 2017 season.
It is in this context that plans are afoot for me to meet with major employer groups, both in the US and Canada, in the coming weeks to promote the program and the quality of our workers with a view to securing more jobs.
Approximately 15,000 Jamaicans were employed in the United States and Canada under the Overseas Employment Program during the last fiscal year. In the meantime, the Labour and Social Security Minister will be making a submission to Cabinet for the mandatory use of the Labour Market Information System, LMIS, to advertise all job vacancies in the public sector.
When all public bodies use the system, at any point in time, the government will be able to know all vacancies that exist in the public sector. I wish to use this medium to encourage employers in the private sector to register and use the system. And guess what, employers? This service is free of cost.
Minister Robinson says the ministry is moving to position the LMIS as the national portal for labour market intelligence and information. She says the country's current unemployment rate, which has averaged over 13% in the last 5 years, is due in part to skills mismatch, resulting in oversupply and undersupply in certain sectors.
The ministry is working to close these gaps through the provision of germane and up-to-date labour market intelligence and career development services.
The Cannabis Licensing Authority, CLA, has received over 200 applications from interested investors since its establishment. This was disclosed by Minister with Joint Portfolio Responsibility for Economic Growth and Job Creation, Daryl Vaz, during his contribution to the sectoral debate. The Cannabis Licensing Authority was established in 2015 under the Dangerous Drug Amendment Act and given responsibility to establish and regulate Jamaica's legal ganja and hemp industry.
With the establishment of the Cannabis Licensing Authority, we may now have one of the best opportunities to enter huge new market for startups.
Minister Vaz points out that in 2015, Forbes magazine reported that up to $1.9 billion worth of cannabis was sold in the United States for medical use and is expected to climb to $8 billion by 2018. He says there is room for innovators and investors to establish medical dispensaries, legal recreational retailers, and edible and infused products, among other business opportunities. A joint submission will be made to Cabinet shortly as government moves to finally delineate or outline the boundary of the Cockpit Country. The joint submission will be made by the Ministries of Economic Growth and Job Creation and Transport and Mining.
Delineation of the boundary of the Cockpit Country is a sore issue which has attracted much public attention. We are aware that several attempts have been made to define the boundaries. But, Mr. Speaker, we are going to complete the process and lay the issue to rest once and for all.
The Cockpit Country has the highest diversity of plants and animals anywhere in Jamaica. Below its surface are rivers, streams and caves which provide some of the best spelunking or cave exploration activities in the Caribbean. And finally, government will be ensuring that public health institutions collect private health insurance to help cover the cost of providing health care to their patients. Portfolio Minister Dr. Christopher Tufton says some hospitals have not been following the requirement and the ministry will be moving quickly to ensure that collection from health card holders becomes the norm.
So this week, Mr. Speaker, I signed an approval for the gazetting of revised fees to be collected from private insurers who interface with the public health system.
Minister Tufton was making his contribution to the sectoral debate in Parliament on Wednesday. He argued that it was not fair for persons who were insured to use the public health facilities and the government loses this revenue, which would otherwise only become part of the funds of private health insurers. The measure is a precursor to plans for a national health insurance scheme, the feasibility of which is to be examined. And that's it for JIS News today. I'm Tamara McHale. Thanks for watching.